Hi parents, this one is for you. So the winter sports season is kicking off soon and you might have a child at home that's been complaining about a bit of discomfort in their knee or heel. This can be growing related. So it can be that your child's going through a growth spurt, and today we're going to discuss two conditions that may be the cause of that discomfort. The two conditions that we're going to discuss, first of all, is Severs disease, which is a problem that we see in the heel of some kids who's growing, as well as we're going to discuss Osgood Sclatters, which is discomfort in the bony point in their knee. So if you ever hear that your child is complaining about pain in those specific areas, or you've ever heard that your child's complaining of that area feeling a little bit swollen or warm, this can be that might be the cause, but we will always just do assessment and do tests to see if that is the case. Now, usually we see this specific conditions in kids due to overuse, so it might be that they are doing multiple sports, and this can include sports like rugby or football, basketball, any type of sports that can be quite dynamic, lots of running, lots of jumping. That's usually where we see that type of discomfort. Now, what would the symptoms be? As I said before, they might complain of a bit of the area having pain, especially with the Osgood Sclatters having a bit of discomfort on their knee over here, and then with their Severs disease having some pain in their heel over there. Another thing that you will also see is swelling. Sometimes they can present with swelling. That is not necessarily always the case, as well as a bit of inflammation in that area. Now, what can we do to self-manage this? So what you can do at home is just putting some ice on that area. Another good idea of something to do is maybe have a bit of a talk to your child and see if they can maybe just focus on one specific sport. Also doing low impact activities like cycling or swimming is a good idea. And then a physiotherapist can also help you with taping the area around your knee or the area around your heel, just to provide a bit of support. And also specifically for Severs disease, what we can also do is just put a bit of a heel raise in the child's shoe, or just wearing a shoe with a slightly increased heel will also help just to decrease that discomfort. If your child's discomfort seems to just be ongoing, it might be a good idea to see a physio so that we can formally assess and see what's going on. There might be some muscle imbalances, especially with a growing child where the bones sometimes grow faster than the muscles. So if your child seems to complain of ongoing discomfort, it's not a bad idea to visit your physio. If you have any further questions, you can give us a call, or you can just book online at rechargephysio.nz. My name is Elzanne and I have a special interest in pediatric physiotherapy.